when the vaccine first came out, I felt like real iffy about it because like how it just came up out the blue, and it's like the government is like pushing people to get it and stuff. But then, like the other side, it's like I want to get it. Like I don't got no problem getting it. I just haven't came around to get it yet.
The pandemic was like, it was life altering. Like our whole world changed, and we're still not like fully back to normal, right? And a lot of things that happened, well, I can't say that they happened, but a lot of things that were televised during the pandemic, I think created just a big sense of distrust and uncertainty. You know, we saw brown and black women and men being harmed and killed, and we knew those things existed, right? But the level of tension and just like the whole world kind of waking up to what has been happening, I think that definitely really kind of created even more of a sense of mistrust. And I think it's so good that you mentioned that, because there's a lot of question and concern, like how did this thing just kind of pop out of nowhere, and is it safe, and what's going to happen? And you mentioned the government. Those are a lot of questions that people have, but and Dr. Miller can speak more to this for sure, but this is a vaccine that has been researched for a long time. And if you think about the impact that COVID had across the world, what happened was all of these research labs, like in the US and across the world, everybody focused their like 100% attention on coming up with this vaccine. And so that's why if things were able to be expedited to make sure that it was, safe.
The type of vaccine, the mRNA vaccine, is not new. That technology has been around for a long time, and they were able, because it wasn't new, and people had used it to try to come up with vaccines for other viruses. They knew a lot about that type of vaccine and could sort of tweak it specifically for COVID-19 to make the vaccine specific for that. So it was a great thing that they had been working on it for a while. They were able to use that knowledge specifically for COVID.
Going off what you guys said earlier, I think the vaccine times, like getting this vaccine out fast, I think a lot of people were scared that it came out too fast. Like there was not enough research for it. I think that's why a lot of people were scared of it.
It did really move fast, again, because we put all our efforts in backing into it, but there's still a process that has to happen. And so they did do research, and they had a good amount of people, like thousands of people enrolled in studies for the different types of vaccines as well, to see if there were any bad side effects that came from it, if it was effective. And so they did do studies for about like at least 6 months to almost a year with the vaccine before they deemed it safe for us to use it as a public.